Sunday live here at Citizen Television. The group CEO of Amref Health Africa, Dr. Githinji Gitahi, has agreed to stay on with us. He is live right here taking your questions. And Dr. I asked you before the break, is it true that more men than women are being affected by this virus? Uh-oh, looks like we have a bit of sound problem, Dr. Sorry.
Sound issues there.
Yeah.
It's me. Sorry, I was on mute.
Okay.
Sorry, can you hear me now? Yes.
We can hear you now.
Sorry about that. So, in terms of numbers of people infected, it's not that significantly different. I think what is significantly different is the number of men dying from COVID-19, rather, as opposed to women dying of COVID-19. I think some of the things that I would say, though, of course, the jury is still out, is that men have a worse, generally, lifestyle than women. Men smoke more than women. Men drink more than women. In some data I've seen, men are likely to drink up to 5 times more than women. They're likely to smoke 5 times more than women in many of the communities. The second thing is men rarely seek help early. And whereas women are more prone to, more expected to seek help, seeking behavior is better than that of men. So there are many things that may explain the pattern of severity, but not the pattern of infection. The pattern of infection may be the same, but I've also seen data saying that men are less likely to wash their hands than women, in which case, even in transmission, you may have a higher risk for men than women. And even in some of the habits like smoking requires you to constantly put your hands next to your face, and that could also be a higher risk in transmission. But all these things are being studied, but I would say the bigger effect is in the severity rather than the transmission.
All right, let's talk treatment. I've seen a lot of reports saying that you treated symptom by symptom. CFO Alvin on Twitter saying, is chloroquine a curative drug? And what are these ventilators?
Is chloroquine a curative drug? Hydroxychloroquine is being tested in many places for this. And I know there is a study now being done by WHO and in many different countries, and maybe Kenya might be a beneficiary of it. So we have some data that shows, yes, it improves the outcome of the patients. But as you know, some of these things require time. You need to confirm scientifically, you need to test, you need approvals, because you don't want to quickly rush to a drug and then later, in a few years later, you say it had a negative effect on people and a negative effect on pregnant mothers, on children growing up. You remember many years ago, there was a drug we used for family planning many years ago, and children many years later started giving birth to children who had no limbs, they were missing their hands. So when you're developing a new drug for a new disease, it takes time. So whereas there is positive results, we have to confirm that truly it adds value without causing harm. So that's what we are doing, and those studies are being done. I think that's what I would say about the drug. Can you remind me what the next question was? Sorry.
Yes, still on Twitter, Bon Steves. Oh, sorry, the ventilator question. Yeah.
Yes, the ventilator. So this is what happens. So when you get infected with the COVID-19, a majority of the people, we must always remember, do not get the symptoms. And that's 8 out of 10. But for those who actually get the symptoms, it means that the virus has overwhelmed their lungs. And their lungs now require support to breathe, because if they're left on their own, they have very fast breathing, they get tired, and the lungs may give up, and that's what causes death. So for you to support a patient who has severe or moderate disease and the lungs are having difficulty in breathing, you then introduce oxygen, and you can give oxygen by a mask. But if the patient is not improving, then you will need to put a tube through their mouth with a machine that that replaces the activity of their lungs. So you're basically telling their lungs to rest, and you're taking over the function of the lungs with a ventilator. The ventilator then is what now keeps giving the oxygen into the lungs in a continuous rhythm, just the way the lungs would do it. It's almost like now giving somebody external lungs, or the lung effect, so that now they have more oxygen because their lungs are tired and they may not be able to take enough oxygen. That's what ventilators do. And we use them not only for COVID-19, they're used for anyone who may be unconscious, people who may require lung support, people who have collapsed lungs or they have extreme disease. So they're used generally, but we are using them for supporting the lungs so that you make sure the person has enough oxygen. That's what they are.
All right. Dr. Latifa has a very interesting question. You buy your groceries, you take them home, you're about to unpack them. What do you do? Do you disinfect them? How do you do that? What do you do with your groceries?
Well, I would assume that the groceries are well handled. And remember that even when we buy groceries from the supermarket, and the advice is always to wash them. You know, this is good basic hygiene. So the first thing is that anyone going into a supermarket now is advised to wash their hands or sanitize. So that's the first thing. The trolleys are sanitized as you go in. So we would assume that the shedding of the virus is less. Would assume that anyone going to a supermarket is wearing a mask so that if they're coughing, they're not shedding the virus. So, of course, the first thing is to make sure that the shedding of the virus is low. The second one is that once you've taken your groceries home, you will want to actually wash them. Sometimes I see people, washing with vinegar and these kinds of things. Of course, we do not recommend that you wash them with, for example, a lot of jik or stuff that have a lot of chlorine, unless it's diluted. If it's diluted, it's safe, because we are also seeing some of the effects of using these sanitizers and these chlorine bleaches. If people use them in the wrong concentrations, they may also cause negative harm in the body. So sanitize your hands, wash your hands. When you dispose the containers or the packaging that was there, dispose that, wash your hands with running water and soap, and wash your vegetables as you would.
All right. And when it comes to preventative measures, we talked about this earlier, Dr. but I think someone needs more clarification. If you can wash these masks and reuse them, especially for those who aren't able to buy them on a daily basis, and how to dispose of them responsibly?
Vicky, this is a big question, because two things will happen here. Number one is that not everyone can afford a mask, and therefore the government has taken the responsibility to do what we may call controlled production and pricing, so that everyone should be able to access one. And even those who can't access, we hope and pray that the government will actually distribute them to those who can't afford them, because this will then become a necessity and a public good. So you cannot be expected to purchase it if you can afford it, but yet you need it. So that's the first thing we need to say, that the government would need to have the efforts to make sure they are available. That's the first thing. Reusing is not recommended. We know that there are people in extreme shortage, who may reuse them, and they may need to probably, some of them that you can rewash, like cloth-based, can be washed and disinfected. But majority of our masks cannot be reused, because remember that when you use it and you're coughing, the big aim of the mask is to capture the aerosols that you may remove from your mouth or from your nose if you're coughing or sneezing, which means that on the inner side of the mask, you may have the virus. So if you're going to reuse it, it means now you're basically reinfecting. And if somebody was to use that same mask, it means that it could be a mode of transmission from you to someone else. So the recommendation is use it once and dispose it properly. Now, that question of disposal is something that is currently being handled very carefully. So I'd not like to spend a lot of time on it, but basically the advice is this is medical waste, because it could be infected. So the disposal of the mask needs to be handled properly. Even in terms of how you handle it when you're removing it, you need to just hold the small harnesses without touching the middle of the outer part of the mask, and then dispose it somewhere in a dustbin and leave it there. And then the government, of course, is going to be planning about how to make sure that all this waste is properly disposed. But we do not recommend reusing, because it could reintroduce infection. But of course, if you are able to use the cloth one and then wash it, disinfect it, and that advice will be coming out very shortly. Now that we are advising people to use masks, we'll be sending this information for public consumption.
All right. Thanks so much for that. Dr. One more question here. Is it true that those who have had BCG vaccination are immune? There's a viewer who wants to know, are they immune, those who have had BCG vaccination?
Well, I've seen a paper that kind of indicates that people who have BCG are less likely, but the correlation may be there. I am not sure that it is a direct correlation of the BCG. Remember, let me first explain that BCG vaccine, for those of our viewers who may not know, is the vaccine we get around here when you're young on your arm, where it stops you from or reduces your risk of getting tuberculosis. That's what we call BCG. And it's given when we are young and leaves a small scar. So many of us can check. If you have a small scar on your forearm on the left side, most likely you got BCG. So what this study is trying to say is that it's realized that countries that don't give BCG, because there are countries that don't give it anymore because they believe, they have their own beliefs or scientific evidence that talks otherwise, or they don't have a high risk of TB, that those countries like Italy have a higher rate of infection, higher rate of moderate or severe disease. I would not comment on that paper. I don't know whether there's strong evidence on that, but I would like to probably say that maybe the fact that you get BCG and therefore reduces your chance of getting TB, maybe it also, reduces latent TB. There's something called latent TB where you may have TB in your lungs, but you don't show disease because your body is strong enough to fight it. But maybe if you have latent TB, it could mean that it also weakens your lungs and therefore makes it more vulnerable to COVID-19. So maybe the relationship could be in the integrity of the lungs. But again, whatever I'm saying, is purely anecdotal and have no scientific basis, but I have seen the correlation between BCG and COVID-19, but I can't comment further on it.
Doctor, before we let you go, there's a big weekend coming up, Easter weekend.
That's right.
Should we get ready for a lockdown?
Well. Let me first say, let's look forward to celebrating, Easter with our families. That's really important that we don't go out and try and make gatherings for this, because as you know, we will still be under the threat of transmission. That is just going on. It's still rising. You've seen the numbers going up. Yeah. So there's no chance to believe that by Easter this should have changed. There will probably be higher numbers getting worse. So let's look for celebrating it with our families where we are. Do not invite friends to your house, because this is something that we are keeping talking about. That social distancing doesn't mean now you can have parties in your house. You put yourself at risk. So let's look forward to celebrating Easter with our families. But lockdown, I don't know, because lockdown is a very complicated thing. I was looking at some data now that says, many Kenyans believe we should have a lockdown, but many Kenyans are not prepared for a lockdown. So a lockdown could be one way of managing or flattening the curve. Remember that lockdown is not a solution to stopping transmission. Lockdown is a way of reducing the rate of transmission. It's basically, we are buying time. That's what lockdown is. We are buying time to get ready. We are buying time to increase our health system capacity. We are buying time to increase our testing capacity so that we can isolate those people who are sick. It's not the end game. The end game is test, isolate, reduce transmission, and adopt new behavior. So this question on lockdown has many ends, many dimensions. It has a social dimension, political dimension, economic dimension, and therefore, whereas Kenyans are ready, asking for it, they are not ready for it, because it's also going to disrupt people's work. So I will leave that question to the government to say when they are ready, because when you are ready for a lockdown, it means that you're also ready to provide social protection to people. You can't just announce a lockdown without saying, and this is how we are going to provide social protection and reduce social harm. When the government is ready for those two dimensions, then we'll be ready for a lockdown. I'm not sure it's time yet.
Absolutely, and the social element has been a huge concern for many.
Absolutely. Dr. Githinji Gitahi, thanks so much for joining us tonight and for really shedding a lot of light.
Yes.
And answering a lot of folks' questions out there. They're still asking the question. Thanks so much for your time, sir.
Thank you. And I'm always ready to answer these questions on Twitter, for those who are able to access me on Twitter, at Daktari1. So the questions never end. I'm receiving a lot of them, and I'm always ready to answer them. And all the best, folks. Be safe.
Thank you so much. Appreciate your time.
At Daktari1, that's the Group CEO of AmRef Health Africa, Dr. Githinji Gitahi there, answering your questions. On that